Hi everyone, my name is Srimayi Kukkadapu, and I'm really excited to be presenting today. And today I'll be presenting about quality healthcare for the impoverished through telemedicine. The poverty gap has always been a global issue in many areas, including healthcare. And today I'll be talking about the way we can use telemedicine to bridge this gap and bring us closer to achieving healthcare equity. So before I get into that, let me start with a little bit about myself. I'm a rising sophomore at Lambert High School in Suwannee, Georgia. I'm the president of V2 Seva, which is a volunteering club at my school. I'm also involved in HOSA, and I have international level achievements. I earned a gold medal for the Barbara James Service Award. I enjoy singing and am doing a Carnatic music diploma. I am passionate about public health and medicine, and I hope to pursue a career as a physician in the future. So what is telemedicine? The dictionary definition of telemedicine is the remote diagnosis and treatment of patients by means of telecommunications technology. In simpler terms, telemedicine is a general term that refers to all the ways you can bring healthcare to patients far away through any means of technology. It includes phone calls, video calls, emails, and text messages. So let me go into the positives and negatives of telemedicine. So there are many advantages that come with using telemedicine. First off, using telemedicine often reduces costs for patients. It cuts down on additional transportation costs, and online appointments tend to be less expensive compared to in-person ones. Telemedicine is also easier to access compared to in-person medicine. As it can be accessed anywhere with internet connection, it makes it much easier for people who are geographically isolated or have disabilities to use. Additionally, patients can easily meet with specialists and well-known doctors that are far away. Telemedicine is incredibly convenient, as patients can have appointments from the comfort of home. A ton of time is also saved, as there is no time spent for transportation or wait time. Many patients also have children or elderly to care for. With telemedicine, there is no need to find care centers for them. Lastly, patients do not need to expose themselves to other sick people at the doctor's office. This makes it so that there is no risk of catching an infection. So there are also many challenges that come with using telemedicine. Though HIPAA's rules protect patients' health information, criminals can potentially hack into a telemedicine system and steal private medical data. Additionally, doctors cannot physically examine patients and take diagnostic tests. This reduces the accuracy of a diagnosis and makes it harder to provide effective treatment. There are also many technological concerns with telemedicine. Slow Wi-Fi can cause buffers and difficulties during consultations. Also, a lot of the population that can benefit from telemedicine are the elderly. However, a lot of them have difficulties operating technology. Lastly, telemedicine might delay emergency care. Healthcare providers may be unable to see how critical of a situation a patient is in. This delays necessary screenings and treatment. So now I'm going to go into a little bit about how healthcare issues that those in poverty face around the world. So first off, the healthcare gap in the US. As of 2020, the poverty rate in the United States was 11.4%, which puts around 37.2 million people under the poverty line. You can see the rising and falling poverty rate in the US throughout the years on the chart on the left. In the US, poverty is associated with many different health outcomes, including shorter life expectancy, higher infant mortality rates, and higher death rates for the 14 leading causes of death. This is mostly because a lot of families in poverty cannot afford healthcare. Many have no health insurance because they simply cannot afford it, as shown on the graph on the right. The graph on the bottom shows how the majority of people who were prevented from obtaining necessary healthcare were uninsured. Many developing countries are in even worse situations when it comes to healthcare. Let me give you a few examples. Approximately 22% of the Indian population lives in poverty. The poverty ratio goes up to 32.75% in rural areas, compared to 8.81% in urban areas. Even though the majority of the Indian population lives in rural areas, only 34% of all physicians are in rural areas. This leaves rural India with a large shortage of healthcare providers, with the majority still traveling more than 100 kilometers to go to healthcare facilities in urban areas. About 70 to 80% of their expenses are out of pocket, making their financial situation even worse. Nigeria is a country that has a shortage of healthcare providers. There are only 4 physicians per 10,000 people as of 2018. Additionally, most healthcare is private, meaning people have to pay out of pocket. According to WHO, 77% of healthcare expenditures in Nigeria are out of pocket. This makes it even harder for those in poverty, which is 40% of the population, to attain healthcare. In the Philippines, many lack access to basic healthcare services due to the shortage and improper distribution of healthcare facilities throughout the country. About 50% of the population doesn't have access to primary care facilities within 30 minutes. Additionally, the poorest Filipinos spend around 60% of household income for food. More than half of healthcare expenditures are out of pocket, leaving families unable to afford healthcare. So now I'm going to talk about the solution and how telemedicine can help. So now that we've seen the problems those in poverty face in regards to healthcare, how does telemedicine help solve these issues? To help figure this out, I set up a telemedicine camp in a small rural village in India called Srimayi. With the help of my parents and friends, I was able to talk to local leaders to help make my goal possible. We contacted several well-known physicians to be a part of the camp. Our healthcare camp was a small center with 3 computers and 3 nurses to assist each patient at each computer. Needed medical equipment like thermometers and blood pressure cuffs were also available. When a patient arrived, the nurse would aid with setting up the call and taking any measurements that the doctor asked. Here are images of similar camps also conducted in rural India. The telemedicine camp was a huge success, and many appreciated me for my efforts. Looking back at the camp, I considered the many ways we saved by using telemedicine rather than in-person healthcare. We drastically reduced travel costs, and time spent for both the physicians and the patients. Using the knowledge I gained through this experience, I was able to come to a few conclusions. In order for telemedicine to be the most effective, it needs to partner with the local community. Setting up small telemedicine centers in areas with internet access will allow those who do not have internet to access telemedicine. The center should use interns or local volunteers to help with technical issues or assisting doctors with any measurements. For more complicated diagnoses, the centers can send blood work to local diagnostic centers for basic tests. This will allow the poor to have easier access to healthcare from experts far away, while still minimizing excess costs. This can be implemented anywhere at whatever scale, depending on the location and the need. I hope we can use the solution to bring true change throughout the world. Thank you. I would like to thank Johns Hopkins University and the Global Health Leaders Conference for giving me this incredible opportunity to present. I would also like to thank the Srimayi community for helping me set up my telemedicine camp. I would also like to thank my family for supporting me throughout my journey. And lastly, thank you for all of you for listening to my presentation. Here are my references. And thank you for listening. I hope you enjoyed my presentation. Here's my contact info if you guys have any questions.